Hi everyone, it's Mr. Sinti, and today I have the pleasure of introducing to you the appendicular muscular system. That's right, these are going to be muscles, you might have guessed it, that are attached to the appendicular skeleton. And if you're unfamiliar with that, the appendicular skeleton is everything but the axial skeleton, which is the skull and vertebral column and ribs. So, what we're talking about is the muscles that are attached to the limbs, both in the arms and forearms and hands, and we're talking about pelvic muscles, and we're talking about legs. Okay, so these are the muscles that are basically stabilizing the pectoral girdle and pelvic girdle, and helping us to move our arms and legs. And so it's a bit of a daunting task, I'm going to have to tell you right out of the gate. And so this is going to be a little bit of a flyover, sort of a drone eye view of the appendicular muscular system. And so I'm also going to innervate this particular video with some videos that I have in order to enhance our understanding. And so I'm going to introduce our first little video clip. And so take a look at this. This is going to introduce you to the pectoral girdle if you're not familiar with it. Whoops. Let me come back here.
The pectoral girdle refers to the bony arch formed by the clavicle and the scapula. The primary function of the pectoral girdle is to act as an attachment point for the muscles that provide arm movement at the shoulder joint. It also provides the only connection between the arm and the axial skeleton.
That's pretty intense. So the clavicle is only attaching to the manubrium, which is the upper part of the sternum right there. And so here's your scapula, here's the clavicle right there. Okay, how about that? So our first muscle on our journey today is the trapezius. That's right. It's sort of named after the trapezoid right there. It's a very, very large muscle right there. This is a posterior view. And the trapezius, yeah, it covers basically your upper back, and it's attached to the base of the skull, as you can see right there, trapezius. And basically it helps to rotate in terms of an action, helps to rotate the scapula, and it's involved in a push-up, if you like that. Like if you're a weightlifter, you'll be familiar with this. It inserts anteriorly at the clavicle. This is a posterior view, but it's also inserts at the scapular spine, which is this little guy that's coming across right there. Okay, so look how large it is. Pretty awesome, trapezius. And then we have your rhomboid and levator scapulae, and that's a little bit deeper to this trapezius. So the trapezius would be over that, in other words. So it's attached to the cervix. I'm sorry. It's a slip of the tongue on that. It's attached to the cervical vertebrae. Okay, so right there. And it's also attached to the thoracic vertebrae right there. And so, as it turns out, there's two rhomboids, a minor and a major, and it adducts the scapula. In other words, bringing the scapula downward in a downward direction. I had cervix in my mind now. It inserts at this scapular border as well, and so you could see right here in the levator, scapulae, and this also elevates the scapula right there. Okay, you can see here it's the two rhomboids right there. There's the minor one right there, and the major right there. And again, it attaches to the vertebral column, and its insertion right there, the movable bone, is the scapula right there on the border. Okay. All right, and let's take a look at that.
There are four muscles that comprise the posterior group: the levator scapulae, the rhomboid minor, the rhomboid major, and the trapezius. The levator scapulae muscle originates on the transverse processes of vertebrae C1 through C4 and inserts on the medial border of the scapula just superior to the spine of the scapula,
which is this part.
The rhomboid minor muscle originates on the spinous processes of vertebrae C7 through T1 and inserts on the medial border of the scapula at the level of the spine of the scapula. The rhomboid major muscle originates on the spinous processes of thoracic vertebrae 2 through 5 and inserts on the medial border of the scapula inferior to the spine of the scapula.
Just below
The
the spine.
trapezius muscle originates on the external occipital protuberance, the medial 1/3 of the superior nuchal line, and the spinous processes of vertebrae C7 through T12. Insertion of the trapezius muscle makes a continuous line from the acromion and spine of the scapula to the lateral 1/3 of the clavicle.
Impressive. Trapezius. Okay, very powerful. So let's also talk a little bit about the pectoral minor, right there, pectoral minor, which attaches to the scapula and helps to elevate the ribs as its action, and the serratus anterior, which inserts on the anterior scapular margin. Let's take a look at that.
The muscles that act on the pectoral girdle, specifically the scapula, can be divided into anterior and posterior groups. Two muscles comprise the anterior group, the pectoralis minor and the serratus anterior. The pectoralis minor muscle originates on the anterior surfaces of ribs 3 to 5 and inserts on the coracoid process of the scapula. The serratus anterior muscle originates from ribs 1 to 8 and inserts on the anterior vertebral border of the scapula.
Okay. Let's talk a little bit now about moving sort of down the shoulder a little bit. Right below the clavicle is this muscle right here, subclavius muscle right there. And basically its action is to depress the shoulder, lower the shoulder. It originates at the rib and it inserts at the clavicle, as you can see right there. Okay. So it helps to depress the shoulder. Now muscles that move the arm. Okay, so moving a little bit away from the shoulder, yet still considered a little bit of the shoulder, is one of the more famous muscles, the deltoid. And again, it's named after the Greek letter D for the triangle, inverted triangle right there, deltoid. And it's a major abductor muscle. In other words, it's able to move the arm away from the midline of the body, deltoid. Then we have your supraspinatus. It assists the deltoid right there, supraspinatus. This is a posterior view of that muscle. Okay, and there's a nice view of it right there, supraspinatus. Here's your deltoid right there. This is a posterior view. And then we have your subscapularis and teres major. It produces a medial rotation at the shoulder. And here's your suprascapularis right there, or subscapularis, and teres major, connected right here to the scapula. These are muscles, again, that are moving the arm. And again, here you could see those muscles that I was just mentioning right there. I was sort of getting ahead of myself. Here's the infraspinatus and teres minor. It produces lateral rotation at the shoulder right there. You can see them here. This one is coracoid brachialis. It attaches to the scapula, and it produces as an action flexion and abduction of the shoulder, adduction at the shoulder, and it's located right there. Coracoid brachialis right there. Again, some of the muscles are more popular than others, and I'm sure you've heard of this pectoral major. Again, it's really prominent on the anterior portion of our chest, and it attaches to the greater tubercle of the humerus, and it produces a flexion at the shoulder, flexes and adducts the arm, are its actions. Very strong muscle. Here it is right here, pectoralis major. Latissimus dorsi. It's between the thoracic vertebrae and humerus. As you can see, it extends from right here of the spine to the humerus. It produces an extension at the shoulder joint, and it can help sort of the body climb. That's one of its actions, and it's enormous. And it literally means, latissimus means broad, so it's a really broad muscle. And basically, it's the only muscle connecting to the arms and to the spine, so it's rather important. Sometimes it's simply referred to as your lats. You might be familiar with that. Same, likewise, your pectoralis major is your pecs. So your pecs and your lats, if you will. Okay, and then here's another picture of the latissimus dorsi. Now we're going to transition to some muscles and tendons that are associated with the shoulder joint, where the humerus articulates with the scapula.
The rotator cuff is a term used to describe the group of muscles and tendons that stabilize and reinforce the glenohumeral joint and assist with the angular and rotational movement of the humerus.
So the glenohumeral joint is where the head of the humerus is articulating with the scapula. And basically it's for rotation, as the name implies, rotator cuff, and stabilization of the shoulder. Whoops.
The rotator cuff is a term used to describe the group of muscles and tendons that stabilize and reinforce the glenohumeral joint and assist with the angular and rotational movement of the humerus.
Okay, there we are. So the muscles involved in the rotator cuff, there's 4 of them.
All 4 muscles combine at the humeral head by way of tendons and form a cuff over the joint, hence the name rotator cuff.
Okay, so again, it's very important. You may be familiar with rotator cuff, or you haven't maybe even considered it, but you may have heard of sometimes athletes will experience injuries. Swimmers will experience injuries, the rotator cuff. Sometimes gymnasts and pitchers in baseball will experience this because just the sheer force of the action of throwing a baseball. And so I wanted to point that out, since it's fairly significant, that if there's a tear to the tendon, and if you're familiar with the fact that tendons are constructed of fibrous connective tissue, they're not very vascularized, and so they don't heal very well, and so surgery is involved. Often it's arthroscopic surgery these days, and basically using the arthroscope, a physician, surgeon will be able to look inside at this the rotator cuff on the top of the humerus. So basically, we're looking at a close-up of these tendons right here, attached to the top of the humerus. And what the physician can do is suture the tendon if there's a tear to the tendons, suture that up so that it can heal a little bit better. And then literally drill into the head of the humerus these suture anchors. So these little metallic screws go in there, and then the surgeon will tease through some suture and then attach it right there, and then that should stabilize the shoulder joint a little bit stronger as a result of that. Pretty cool. And again, these are the muscles that form the rotator cuff right there, and you can see that it's sort of like a cuff. In other words, it's covering, like a cuff covers the wrist, covers the shoulder joint. Okay, and so now let's talk a little bit about the muscles that are moving the forearm and the hand. Now there's several, and so again, this was just a flyover video, just looking at some of the muscles of the appendicular skeleton. So, but I do welcome you to investigate further. Maybe this is going to whet your appetite, so to speak. And so we can classify these muscles that move the forearm and hand as extensors, and those are mainly on the posterior lateral surfaces of the arm. Okay, so extending the arm in a backward direction, extending, and then flexing the arm, or basically on the anterior side of the humerus, so facing. So in anatomical position right here, these are your flexors right here, and they're often more medial. Okay, let's take a look at this.
Muscles that extend the forearm are located posteriorly, while those associated with flexion of the forearm are located anteriorly.
All right. One of, again, a famous muscle, biceps brachii, which is capable of flexing at the elbow. It flexes the elbow, and it also helps to stabilize the shoulder joint right there. It does originate at the scapula, as you can see right there. It's originating at the scapula, and it inserts, or in other words, it attaches to the radial tuberosity, which is causing the radius to be able to move upward in a flexing motion. We also have the brachialis and the brachioradialis. Let's take a look at these flexors of the elbow.
The forearm flexors consist of the brachialis, the brachioradialis, and the biceps brachii. The brachialis muscle originates on the front distal half of the humerus and inserts on the coronoid process of the ulna.
All right. Okay. All right. Extensors of the elbow are, again, fairly famous. Triceps. All right. The triceps are, this is a posterior view right here. Tri meaning three heads. You have a medial, a long head, and a lateral head. Okay. Triceps brachii. And they originate at obviously, or maybe not obviously, but they originate at the scapula right there. But they insert on the ulna at the olecranon right in here. In other words, some people just refer to this as your elbow bone right there, but it's basically your ulna. That's where it's inserting. So it causes the extension of the arm at the elbow hinge joint right there. Okay. Now, in terms of moving the forearm, not just extending and flexing, we can also have pronation, in other words, turning the palm backward, and supination, holding the palm in an upward direction as if you're holding a bowl of soup. So we have pronators and supinators that help to move the forearm. Let's take a look at this.
Muscles of the forearm that function in pronation and supination are the pronator quadratus, the pronator teres, and the supinator.
So there's three of those. Okay. And again, they're involved in supination of the forearm.
The pronator quadratus muscle originates on the distal ulna and inserts on the distal radius. The two-headed pronator teres muscle originates on the medial epicondyle of the humerus and the coronoid process of the ulna, with fibers converging distally to insert on the mid-lateral surface of the radius.
Useful to know your bones.
Contraction of these two muscles results in forearm pronation.
Okay. And again, I'm not going to name the numerous muscles that are inside the forearm, but basically, I'll say this is that they're the tendons that move the hand, or only the tendons are actually crossing the wrist right there, which I find kind of interesting thing to point out. And then you might be familiar with the term intrinsic. Intrinsic muscles are muscles within an organ. Like, in other words, there's intrinsic muscles of the hand, and there are several inside here, and they help to move the metacarpals and phalanges. All right. And so now we're going to be moving down, and so let's talk about the muscles that position the lower limbs. And so we have like three groups to consider: muscles that move the thigh, okay, which are significant, and then legs that move the legs. We were just talking about moving the arms, so moving the legs, and then muscles that move the foot and toes. Okay, so let's take a look. Start off at the muscles that act on the hip joint and femur as a little preview.
The largest muscles in the body are found in the lower limb and the associated hip joint. The hip joint is a ball and socket joint, which, similar to the shoulder joint, is capable of a considerable amount of movement. However, in contrast to the shoulder joint, the muscles of the lower limb are adapted more for strength than precision. Nevertheless, the muscles still show a complex array that can be separated into three categories: anterior muscles, medial muscles, and posterior muscles.
Okay, so a little warm up there. So we're basically going to look in. So the muscles that move the thigh are sort of grouped in these four categories. We have these gluteal muscles. You might be familiar with this. We have lateral rotators, and then adductors, and then Iliopsoas muscles. And so let's take a look at these glutes, as they're sometimes referred to. So gluteus maximus. All right, here it is. Very large posterior gluteal muscle, sometimes known as the butt muscle right there. It produces extension and lateral rotation of the hip. That's right. Your gluteus maximus, in other words, your large glute. And then you have gluteus medius and gluteus minimus. Okay, so those are anterior. In other words, if you were to you cut away the gluteus maximus, as you can see in this diagram, then you would see these are also cut, but these are anterior, more to the front. This is again a posterior view, right in here, and the this particular medius and gluteus minimus is inserting on the greater trochanter, which is, as you can see right over here, this little protrusion right here, greater trochanter of the femur. That's where it's inserting. Okay, and then we have this tensor fasciae latae. It's a mouthful. Tensor fasciae latae, if you will. Latae. Hopefully I'm pronouncing that. I apologize if I'm not. So it works with the gluteus maximus, and basically it's located right here. You can see right here is your tensor muscle right there and right there. And it's associated with this IT band, or iliotibial tract. This particular band of fibrous connective tissue, it may be obviously it strengthens the tensor muscle, but it also helps to stabilize the knee joint laterally, and so it's really important. You can here's a look at the gluteal group again. There's three of these muscles that make up the glutes. And then here's a nice look at this IT band right here. And then this is this tensor fasciae latae right in here. And then here's your IT band. And as you can see this a little bit better, as you can see how the fibrous connective tissue comes laterally. This is the lateral view, which is helping to stabilize the knee joint. Okay. Now here's your lateral rotators, and again, these are muscles that are moving the thigh. They're a group of 6 muscles that are helping to move the thigh, as I was mentioning before. There's obturator and piriformis muscles right there. And again, let's take a look. The piriformis is located right there. And your obturator internus is located here, right in here, helping to move the thigh. And then this second or third class of muscles that are helping to move the thigh are your adductors, or hip flexion, if you will. So let's take a look at them.
There are 5 medial muscles that cross the hip joint: the adductor magnus, the gracilis, the pectineus, the adductor brevis, and the adductor longus. The adductor magnus originates on the inferior ramus of the pubis, as well as the ramus and tuberosity of the ischium. The muscle inserts on the linea aspera, the gluteal tuberosity, and the medial supracondylar line of the femur. the gracilis muscle originates on the body and inferior ramus of the pubis, and the ramus of the ischium. The insertion is on the medial surface of the tibia, just below the tibial condyle. The pectineus muscle originates on the superior ramus of the pubis, and inserts on the spiral line of the femur. The adductor brevis originates on the body and inferior ramus of the pubis, and inserts on the linea aspera of the femur. The adductor longus originates on the body and inferior ramus of the pubis, near the pubic symphysis, and inserts on the linea aspera of the femur, below the adductor brevis.
Okay, so, that's a lot of information to take in. And so, you're welcome to review that. You can pause it at any time just to let you know. Basically, what this is happening is that it's moving your thigh, but what it's doing, it's adducting it. In other words, it's moving the legs toward the midline. And so there's 5 muscles involved in that flexion, that hip flexion right there. So let's take a look at this. This is good right here. This is the hip flexors that insert on the same tendon. Let's take a look.
The 2 principal anterior muscles of the hip are the iliacus and the psoas major. Collectively, they are known as the iliopsoas muscle because they share a common insertion on the lesser trochanter of the femur.
So iliopsoas.
The iliacus muscle originates on the iliac crest and fossa of the pelvis. The psoas major muscle originates on the bodies of vertebrae T12 through L5 and the transverse processes of all lumbar vertebrae.
So psoas major, like that. Psoas major, that's cool. Okay, now we're going to take a look. This is sort of closing the whole sort of hip joint and reviewing a little bit of what we have been discussing.
The posterior muscles that cross the hip joint begin with 6 deep muscles that are collectively referred to as the lateral rotators, named for their action on the femur. They are the gemellus superior, the gemellus inferior, the obturator externus, the obturator internus, the piriformis, and the quadratus femoris. Superficial to the lateral rotators are the 3 gluteal muscles, the gluteus minimus, the gluteus medius, and the gluteus maximus. And located laterally is the tensor fasciae latae,
which connects to the IT band.
The gemellus superior originates on the ischial spine and inserts on the greater trochanter of the femur. The gemellus inferior originates on the ischial tuberosity and inserts on the greater trochanter of the femur. The obturator externus originates on the outer surfaces of the obturator membrane, the pubis, the ischium, and the margins of the obturator foramen. The insertion is in the trochanteric fossa of the femur. The obturator internus originates on the inner surface of the obturator membrane and the margins of the obturator foramen. The insertion is on the greater trochanter of the femur.
Okay.
The piriformis originates on the anterior surface of the sacrum and inserts on the greater trochanter of the femur. The quadratus femoris originates on the ischial tuberosity and inserts on the intertrochanteric crest of the femur. The gluteus minimus and medius originate on the lateral surface of the ilium and insert on the greater trochanter of the femur. The gluteus maximus originates on the dorsal ilium, the sacrum, and coccyx, and inserts on the gluteal tuberosity of the femur and the lateral condyle of the tibia via the iliotibial band.
So again,
Tensor fasciae latae originates on the iliac crest and the anterior superior iliac spine, and inserts on the tibia via the iliotibial band.
again, I've said this before, but to the degree that it's valuable to you as the viewer, the knowing the origin of the muscle attachment to the skeletal system is either important or non-important. It's up to you. It's whether or not you are interested in the motion of these particular muscles. In other words, where it's fixed at the origin, and then where it's inserting is where it's acting in terms of where the muscle that's in motion. Okay, so that's the insertion, and then as we're talking about rotation a lot, which is the action of these muscles. Okay, and so moving along, we're moving now towards the muscles that move the leg. So we have flexors of the knee and extenders of the knee. Okay, so the flexors originate at the pelvic girdle, and the extensors originate at the femoral surface and insert at the patella. Let's take a look at that.
Muscles that act on the knee joint form most of the mass of the thigh and are located both anteriorly and posteriorly.
And these particular muscles that move the leg are also very famous, as you would imagine. And so let's take a look first. Some of the more famous muscles, posterior muscles of the femur, or of the lower leg, are the hamstrings. Okay, and they're involved. The hamstrings are involved. They're located right here. They're involved in flexing the knee. Okay, so hamstrings, kind of a weird name, if you will, although it's so commonly used, we don't give it much thought. I don't know. I don't. But I was sort of looking at the origin of those hamstrings, as it turns out that butchers used to grab pigs when they were slaughtering the pigs and dicing them up for meat. They would actually hook them in the butcher's area on tendons of these particular muscles of the leg, and so they became known as hamstrings. And a way to remember that there's three muscles is sorry about that, three little pigs. And so the three pigs. And so let's take a look at these hamstring muscles that are flexing the knee.
The posterior muscles of the thigh that flex the knee are the biceps femoris, the semimembranosus, and the semitendinosus, collectively referred to as the hamstring muscles. Also included as a flexor muscle of the knee is the popliteus muscle. The long head of the biceps femoris muscle originates on the ischial tuberosity of the pelvis, and the short head on the linea aspera and lateral supracondylar line of the femur. The insertion of the biceps femoris muscle is the head of the fibula. The semimembranosus muscle originates on the ischial tuberosity of the pelvis and inserts on the medial condyle of the tibia. The semitendinosus muscle originates on the ischial tuberosity and inserts on the medial surface of the tibia. The popliteus muscle originates on the lateral condyle of the femur and inserts on the posterior surface of the tibia.
Okay, hamstrings. And you can see them here. Three large muscles right there in this posterior view of the thigh. Okay, and then again, also very famous, people are familiar with this, are quadriceps, and they're involved in the extension of the knee. In other words, an upward movement of the lower leg. And the quadriceps are located anteriorly in the thigh. Quadriceps, because there's four heads involved, so quadriceps femoralis, as the four muscles are referred to collectively. There's three of them are vastus muscles, as the video will indicate. There's three of them, and then there's the rectus femoralis muscle, which is right here in the front. Rectus meaning straight, femoral, right there. Let's take a look at these four muscles, the three vastus and the rectus femoralis.
The anterior muscles of the thigh that extend the knee are the quadriceps femoris muscle and the sartorius. As the name implies, the quadriceps femoris muscle has four heads: the vastus medialis, the vastus lateralis, the vastus intermedius, and the rectus femoris, all of which converge to insert on the patella, the tibial tuberosity, and the lateral and medial condyles of the tibia. The vastus medialis originates on the intertrochanteric line, the linea aspera, and the medial supracondylar line of the femur. The vastus lateralis muscle originates on the greater trochanter and intertrochanteric line, the gluteal tuberosity, and the linea aspera of the femur. The vastus intermedius originates on the anterior and lateral surfaces of the femur. The rectus femoris muscle originates on the anterior inferior spine and superior margin of the acetabulum. The sartorius muscle, also known as the longest muscle of the body, originates on the anterior superior iliac spine and winds around the knee to insert into the medial proximal tibia.
Let's take a look at that sartorius. Okay, so that sartorius, again, attaches up here in the hip, and it originates as sort of superior to the acetabulum, which is the ball and socket joint where the femur is attaching to the hip. And it's famously known as the longest muscle in the body, right there. Okay. All right, and then moving down finally to the muscles that move the foot and toes. And so the muscles that produce extension or plantar flexion at the ankle. And those are your gastrocnemius and your soleus muscles. And sometimes they're just commonly known as your calf muscles. But I find the soleus to be kind of interesting. Reading about that, it's sort of where the fish called the sole is named after this. So a flat muscle, but also it's also meaning like sandal, solus in Latin. So let's take a look at these calf muscles.
The superficial posterior compartment contains the soleus muscle and the gastrocnemius muscle. The soleus muscle originates on the proximal 1/4 of the fibula and the middle 1/3 of the tibia. The insertion of the muscle is on the calcaneus,
heel bone.
The gastrocnemius muscle originates on the medial and lateral condyles of the femur and inserts on the calcaneus.
Okay. Of significance of how it attaches to the calcaneus is via the calcanean tendon right there, as you can see. All right. And so here's your solus right there. Gastrocnemius right over here and here, both medial and lateral. And again, the calcanean tendon, fairly famous, is known as your Achilles tendon right there, and it's shared by the gastrocnemius and solus. So they sort of they fuse together there, attaching to the heel bone, calcaneus right there. And so, as it turns out, this seemed to be, like in the Greek mythology, basically a weak spot for Achilles, if you're familiar with this story. So again, you can see the calcanean tendon right over here. And then, again, I'm not mentioning every one of the muscles involved in the as ankle extensors and ankle flexors and all of these, but it's again, I already feel like I'm overstating my welcome, but finally, intrinsic muscles of the foot. So these are, again, muscles that are found inside an organ, like, for example, the foot, and they originate at the tarsals, which are these little bones right here, and metatarsals, and they help to move the phalanges. In other words, move the toes. So, surprisingly, a brief look at the appendicular muscles of the human body, and I hope you found it interesting. And again, don't get overwhelmed by the information provided in the videos. I thought they're useful, and I made a decision to sort of integrate them into this presentation because there's a lot of information, and it sort of breaks it up a little bit. But it's basically all of that information regarding the anatomy. In other words, like the insertions and origins and actions can be either looked up in textbook or on the internet. So hopefully this is an opportunity or an invitation to want to learn a little bit more about these muscles. Okay? Thanks for watching. Hope you enjoyed it.